You're tuned in to the deep dive, and today we're tackling something that can really throw you for a loop. Sudden sensorineural hearing loss.
Yeah, SSNHL, or just sudden deafness.
Exactly. Imagine your hearing just fading, almost instantly sometimes. That's what we're going to explore today.
Right. It's that abrupt loss. Our sources define it as a drop of at least 30 decibels across 3 connected frequencies.
And all happening really fast.
Yeah, within about 3 days. Often, people say it's the first thing they notice when they wake up in the morning.
Wow. And here's something that I found surprising. In the vast majority of these cases, what is it, around 88%?
About that.
The exact cause just isn't found. It's a puzzle.
That's right. Doctors call it idiopathic, which, well, it can feel pretty unsettling when you just want to know why it happened.
Absolutely. And while it might sound like something really rare, it's actually, well, it's more common than you might think.
Yes. It is. We're looking at roughly 4,000 new cases diagnosed in the U.S. each year. But the true number, some estimates suggest it could be much higher, maybe even up to 15,000 annually.
Okay, so there's a bit of range there. The reported numbers do vary a bit depending on the study, right?
Yeah, you'll see figures like 5 to 20 cases per 100,000 people.
But some newer research puts it higher.
Exactly. Closer to 27 per 100,000 in some recent literature. It's a bit lower in kids, maybe 11 per 100,000, and tends to tick up as we get older.
And it's not just the hearing loss itself, is it? There are other things that can go along with it.
Definitely. Our sources mention associated symptoms like tinnitus, that's the ringing or buzzing sound.
Right, that persistent noise.
And also a feeling of pressure or fullness in the ear, oral fullness, plus sometimes dizziness or even vertigo, that real spinning sensation.
Okay, so our goal for this deep dive is really to dig into what our sources are telling us about this sudden deafness. We want to understand the different ideas about what might be causing it and, the ways doctors are trying to treat it.
Trying to cut through some of the complexity.
Exactly.
Okay, so to start understanding this, it helps to look back a little. It seems the first time SSNHL was scientifically reported, like written up formally, was in 1944.
1944. That feels surprisingly recent in medical terms.
It kind of does. And since then, well, there's been a lot of investigation into what might trigger it. The list of potential causes that have been suggested is pretty broad.
Yeah, I saw that. Things like problems with blood circulation in the inner ear.
Circulatory disturbances.
Exposure to things that can damage hearing, ototoxicity, physical trauma, even like abnormal tissue growth or neoplasms.
That's right. And the sources also add vascular occlusions, blockages in those tiny blood vessels.
Like tiny clots.
Could be. Also, viral infections are often suspected. And things called labyrinthine membrane leaks, like a tiny rupture inside the inner ear mechanism.
Okay.
Then you got immune system issues, maybe the body attacking itself, or even just an abnormal stress response within the cochlea, the hearing organ itself, or damage to the membranes in there.
So it sounds like in most cases, there isn't one single clear smoking gun.
That seems to be the consensus, yes. The current thinking is that SSNHL is likely multifactorial. Meaning it's probably a mix, a combination of several different things contributing rather than just one single cause. And that complexity is really the core challenge here.
Right. It makes finding a single cure difficult.
Exactly. Now, some of the early research, this is interesting, focused on something called hypoxic injury.
Lack of oxygen.
Precisely. The idea was that if the fluid in the inner ear, the perilymph, doesn't get enough oxygen, it could damage those very delicate hair cells needed for hearing.
Makes sense. Cells need oxygen.
But then the research kind of broadened out to look at circulatory problems more generally. The idea of a vascular cause really gained traction, thinking about thrombotic or embolic events.
Clots again, basically, blocking blood flow.
Yes, potentially impeding blood flow to the inner ear.
And then our sources mentioned something I found a bit counterintuitive. A possible link between low blood pressure, especially in younger, healthy people, and SSNHL.
Yeah, it does seem a bit odd at first glance, doesn't it? Being hypotensive, possibly making the ear more vulnerable.
How would that work?
Well, the thinking is that the blood supply to the inner ear is already quite delicate and finely tuned. So perhaps lower systemic blood pressure might just reduce that crucial blood flow enough to make the inner ear more susceptible to damage from, other minor insults or stresses.
Interesting. So moving beyond these sort of direct inner ear mechanisms, what about our general health? Do existing conditions play a role?
They certainly seem to. Our sources link several common conditions to a higher risk of developing SSNHL, things like hypertension, high blood pressure,
Okay.
diabetes, and hyperlipidemia, which is high cholesterol or fats in the blood.
Right.
Increasing age is also a factor, as is alcohol use and cigarette smoking. All seem to be associated with increased risk.
And there was something about cholesterol and blood vessel function being early markers.
Yeah, some research suggests that elevated cholesterol and something called impaired flow-mediated dilation, basically how well your blood vessels relax and expand, could potentially be early warning signs.
Okay. And what was that ratio mentioned? Neutrophil to lymphocyte?
NLR, yes.
Uh-huh.
Neutrophil to lymphocyte ratio. Apparently, a higher NLR might indicate underlying inflammation or even predict ischemic conditions, reduced blood flow in some SSNHL patients. It could be a useful biomarker down the line.
So many potential factors.
It really is. And on top of all that, you still have these competing theories involving viruses, immune responses, general inflammation, various cellular stressors. It just highlights how incredibly intricate this condition is.
Okay. It's definitely a complex puzzle. Let's switch gears then and talk about treatment. How do doctors actually try to tackle this? One of the mainstays seems to be corticosteroids. Why those?
Well, the primary reason is their strong anti-inflammatory effect. The underlying theory, for many cases anyway, is that some kind of inflammation is damaging the cochlea.
So the steroids calm that down.
That's the goal, yes. Reduce the inflammation, hopefully limit the damage, and allow the hearing structures a chance to recover.
Makes sense. And what does the research say about how well they actually work? Our sources mentioned reviews looking into this.
They did, and, well, like a lot of medical research, the findings are somewhat mixed. It depends a lot on the study design, who was included, and so on.
Okay.
Some studies, including some good randomized controlled trials, have shown significant improvements in hearing with corticosteroids.
How are they given?
Either systemically so, pills or injections that affect the whole body, or sometimes directly injected into the middle ear space, which is called intratympanic injection.
Oh, right near the source.
Exactly. And sometimes those methods are even combined. So it's not that they don't work, but their effectiveness isn't uniform across all patients or all studies.
Right, because you also mentioned that some studies didn't find a significant difference between patients who got steroids and those who didn't, or who got a placebo.
That's also true, which leads to an ongoing debate in the field about, well, first, is systemic or intratympanic delivery better, or is combination best? And also, what's the right dosage? How long should treatment last? There are still questions.
And we should probably mention the downsides of systemic steroids, too. They aren't without risks.
Absolutely not. Our sources list potential side effects like high blood sugar, increased blood pressure, stomach issues like bleeding, cataracts with long-term use, and even mood changes.
So doctors have to weigh the potential benefit against those risks.
Definitely. Especially when the evidence for benefit isn't always crystal clear for every single patient.
Okay. Now, another treatment that pops up quite a bit is hyperbaric oxygen therapy, HBO. What's the thinking behind using that for sudden deafness?
The basic rationale is to flood the body, and therefore the inner ear, with much higher levels of oxygen than you'd get just breathing normal air.
How does that help?
Well, if the hearing loss is related to compromised blood flow or lack of oxygen, that hypoxic injury idea we talked about, then breathing pure oxygen under pressure in a special chamber might help deliver enough oxygen to those struggling inner ear cells and potentially help them recover function.
Okay. So what's the evidence look like for HBO as, say, the first treatment someone gets?
Again, it's a bit of a mixed bag, similar to the steroid story. Some studies have reported statistically significant hearing improvements in patients who received HBO compared to those who didn't.
But not all studies.
No, others haven't found that clear benefit over control groups. And a complicating factor is that the way HBOs is given, the pressure used, the length of the sessions, the number of sessions varies between studies.
Ah, so it's hard to compare apples to apples.
Exactly. Makes it tough to draw firm conclusions sometimes.
What about using it if the first treatment, maybe steroids, doesn't work? A sort of backup plan.
Yeah, that's called salvage therapy. And you guessed it, the research there is also mixed.
Okay.
Right. Some studies suggest HBO might offer some additional benefit for patients who haven't recovered after their initial treatment, but others don't really show a clear advantage in that salvage situation.
What about combining them? Steroids and hyperbaric oxygen together?
Logically, you'd think that might be better. And some studies have looked at this combination. A few suggest it might be particularly helpful for people with really profound hearing loss right at the start.
Yeah.
but other studies haven't found that the combination is significantly better than just giving corticosteroids alone. So the jury is still kind of out on whether adding HBO always provides extra benefit.
Okay. And I think our sources even mentioned looking at HBO for more chronic long-term hearing loss.
Yes, that's a much less explored area, but there is some research dipping its toes into whether hyperbaric oxygen could potentially help with hearing issues that have been around for a while. But the main focus is definitely on that acute, sudden onset phase.
So overall for HBO, like with the steroids, it sounds like the science is still evolving. There are limitations.
For sure. As our sources point out, there's a real need for more large-scale, rigorously designed studies, the kind that give us the strongest evidence.
The gold standard trials.
Right. And that variability in treatment protocols we mentioned, that also makes it challenging to synthesize all the findings effectively.
Okay. So corticosteroids and HBO seem like the big ones discussed, but the sources listed a whole bunch of other things that have been tried too.
Oh yeah, there's quite a list.
Hmm.
Many other approaches have been explored over the years, often based on different theories about the cause.
Like what?
Things aimed at improving blood flow, like osmotic diuretics to reduce fluid pressure, volume expanders, recologic agents, which are drugs meant to make blood flow better,
Okay.
meds like pentoxifylline, dextrin, even things like plasmapheresis, which filters the blood, or therapeutic phlebotomy in specific cases.
Wow.
Plus vasodilators to open up blood vessels, antivirals based on the infection theory, anticoagulants based on the clot theory.
Huh.
The list goes on.
But have any of those really panned out?
Well, the key takeaway from our sources is that despite all these attempts, no single one of these other protocols has consistently shown itself to be superior or more effective than the more standard approaches like corticosteroids for most patients.
Okay. So with all these different treatments being tried and the results often being, well, mixed, I guess researchers try to combine results from many studies, meta-analyses and things like that.
Absolutely. That's a crucial step, looking at the bigger picture. Things like Cochrane reviews try to systematically gather and analyze all the available research on a topic.
And what have they found for SSNHL treatments?
They've looked at corticosteroids, antivirals, vasodilators, HBO, the whole range. And the general conclusion often is that while some treatments show signs of promise,
Uh-huh.
the overall strength of the evidence is frequently limited. Usually because the individual studies included might have design flaws or small numbers of participants, or they just aren't consistent enough with each other.
So even for systemic corticosteroids, which you said are often the first choice,
Yeah, the go-to.
even their effectiveness is still debated based on these large reviews.
That's a fair summary. Their position as the standard of care is widely accepted, but the magnitude of their benefit and for whom is still discussed based on the totality of evidence.
But there was one potentially positive finding from a Cochrane review mentioned for HBO.
Yes, that's right. Our sources highlight a specific Cochrane review focusing on HBO, which did find a statistically significant average improvement in hearing across the different frequencies tested.
Okay.
And notably, the benefit seemed greater when the HBO therapy was started relatively early, soon after the hearing loss began. That's a potentially important piece of the puzzle.
Definitely sounds like something worth pursuing more. Now, who actually gets offered these treatments? Are there guidelines for selecting patients?
Yes, there are. The American Academy of Otolaryngology, for instance, has guidelines. Generally speaking, patients who have a more severe initial hearing loss, often defined as greater than 40 decibel, and especially those who seek medical help quickly, typically within the first 14 days after the symptoms start, are the ones most often considered for treatments like HBRs, sometimes alongside steroids.
Timing seems key then.
It often is in medicine, and it appears to be the case here too.
And what about the overall outlook? If someone experiences this, what's the prognosis? Does hearing usually come back?
Well, there's actually a decent chance of some spontaneous recovery. The sources suggest somewhere between 30 and 60% of people will get some hearing back on their own without specific treatment.
Oh, that's higher than I might have guessed.
It is encouraging. However, for the other 40 to 70% who don't fully recover, the resulting permanent hearing loss can have a really significant impact.
How so?
It can affect communication, social interaction, potentially lead to feelings of isolation, anxiety, depression, and even create challenges with employment. It's definitely not trivial.
No, absolutely not. Okay, one last important point before we wrap up. Sudden hearing loss isn't always SSNHL, right? There's something called differential diagnosis.
Yes, that's crucial. Doctors need to rule out other conditions that can mimic sudden hearing loss.
What sort of things?
Could be problems located beyond the cochlea, maybe with the auditory nerve itself. Those are called retrocochlear disorders. Certain infections like meningitis, mumps, syphilis can sometimes present this way. Also, traumatic causes like a head injury, other vascular events like a stroke affecting hearing pathways, or even, though rarer, neoplastic causes like tumors, such as an acoustic neuroma.
So a proper checkup is essential.
Absolutely. A thorough medical evaluation is needed to make sure the diagnosis is correct and rule out these other possibilities.
Okay, so bringing this all together, our deep dive into sudden sensorineural hearing loss really shows it's a pretty complex medical situation.
Definitely. Lots of potential underlying factors, a range of treatment approaches, none of which are perfect fixes for everyone.
Corticosteroids seem to be the frequent first step.
The common starting point.
And hyperbaric oxygen therapy shows some promise, particularly if it started early. But like you said, more solid research is really needed.
That's the bottom line. We need more high-quality studies to really nail down the best treatment protocols, figure out who benefits most from which therapy, and maybe even understand the underlying causes better.
And, just to reiterate, the information we've gone through today is based on the sources we had, and it really reflects this ongoing scientific conversation.
It's a snapshot of where things stand now.
Mm.
And it kind of leads to a final thought, perhaps, for you listening.
Yeah.
Given all this uncertainty that still surrounds the exact causes and the debates about the best treatments for SSNHL, what does that really highlight for us about the challenges, the broader challenges of understanding and treating complex biological problems in general?
That's a great question.
It really underscores why continued research is so vital and maybe pushes us towards thinking more about personalized medicine, figuring out the right approach for each individual rather than a one-size-fits-all solution.